the warm welcome. Hello, everyone. It's a pleasure to be able to connect with you all and to talk about community health needs assessment. So what I thought we could do is I will talk about what the process of needs assessments are and why they're important. And then we can have a good discussion for, about 45 minutes. And I do have a little bit of leeway there. But it's great to be here. So thank you all. And I did just get my MBA. So just know that it is never too late. Always learn and continue to develop. So let me do my best to share my screen. Can you all see the slides now?
Yes.
Okay,
Yes.
Good deal. If I'm ever having a tech glitch, by all means, please let me know. So let's just dive right in and talk about community health needs assessments and why they're important. They are important because, wait, I'm trying to get the video out of the way. Okay. They are important because they offer an opportunity to identify community gaps as well as opportunities. So you all know about public health. You all understand that there are dynamics relating to equity, that there are national challenges that we face relating to public health, whether we're talking about chronic disease or communicable disease. And so what a needs assessment does is it distills down what is important for whatever geographic area the needs assessment may be for. Maybe it's a city, maybe it's a county, which now is actually required, particularly for nonprofit hospitals. And when they are working well locally, they're working with a health department. Or sometimes they can be a needs assessment that is crafted toward a specific population. And so you can always bring the benefits of a needs assessment to the table, whether you are in a specific area or maybe you land at a job that focuses on a specific population that might be dispersed nationwide, whether it's uninsured or underinsured or specific racial and ethnic groups. So you can craft the needs assessment in different ways. And so, a really important part of the needs assessment process, because you are collecting a lot of information, and we will get into the details of that, and definitely just write down your questions. I like to run through the foundational information, and then we can just open up the floor, because I want to know what you all have to say, and I want to make sure that this is all landing for you and is as practical as possible. And so if you think about a needs assessment, they can be very robust documents. At the end of the day, a needs assessment is a file of a whole lot of data. It's a report. And then from there, it gets distilled into specific formats that you might see. You might see a dashboard online, or you might see a blog or infographics, but needs assessments themselves can be very robust. The one for Dallas County, which is where I'm in the Dallas area. It's a larger county, one of the top 10 in the nation. So it might have had a little bit more to sift through, but in the early 2000s, its needs assessment was 900 pages long. And, I think there's opportunity to be a little more efficient in efforts, but that just shows you how robust they can be. I've seen in more recent years, you do them maybe every few years, that they're a couple of hundred pages. And then there are some smaller jurisdictions that might really do a slide presentation and keep it very to the point. And they're not nearly as long. They might be 60 slides or something. So there's not necessarily a wrong way to deliver the needs assessment, as long as you're true to accurate data collection and representing, the data properly. So given how large the assessments are, collaboration is certainly necessary, because you don't want to tell a story about a population or a community without involving them. It never works well. You don't want to descend down with your data and say, here are all the problems with your area or with your community. So a very intentional aspect of the community health needs assessment process is deciding who all needs to be at the table, who all do we want to hear from. And so usually the leads of the process will decide, and it could be upwards of maybe 20 or so partnering organizations where they would each send a representative. Any more than 20, and it starts to get difficult to get on the same page, to navigate challenges, but 20 is a good number where you can include the health department, of course, because there are specific requirements where the health department has to be involved. I mean, they almost mandate the partnerships, right? And then also you want the hospital systems, local universities. A lot of universities have institutes relating to health or public health or urban planning. And so you want the universities to be involved. Any federally qualified health centers. So another type of hospital. So, and then nonprofits as well. So you really want to sit back and understand who serves your community and how do we get them at the table. And then you want to define the collaborative process. And so, as I mentioned, you get really intentional about that. There are, approaches called the MAP process, for example, which comes from NACHO, the National Association of City and County Health Officials. If you see it written out, sometimes you think nacho, it's kind of a running, unfunny joke, I guess. But there are processes to govern the collaboration where first you talk about what you feel the challenges are in the community, and you adopt an exploratory approach among all these leaders. So these 20 leaders you've gotten together, you might be at the table as the public health lead, and you guide them through the necessary questions to think about, sharing back with them all along the way how you are incorporating their thoughts. They are opinion leaders, they are thought leaders. At the same time, you all are the ones that will know public health. You all are the ones that will know needs assessments. And so it's an exercise of facilitation, collecting a lot of responses so that you can start crafting what the needs assessment is going to look like. And then from there, you start narrowing it down. So an assessment is just that. It is assessing what health gaps and opportunities are. And so once you have spoken with the community leads, you can start defining a reasonable scope. And just know that all of this depends on how much time you have available, and it also depends on how much money you have available. I would say typically especially if you're working with like federal funds, for example, you can't really exceed a year when it comes to the work that you're doing. So a year, I believe, is a solid amount of time to execute a needs assessment. At the same time, if you have hospital systems involved, a lot of times it might be their funds where you're not restricted to the year, but people kind of get tired of it after that anyway, So you don't want to overburden, but you do want to be collaborative and responsive to the needs that you hear. So after you create this narrowed down agenda and indicators, so specific priorities, you can start getting into what it is you want to research for the needs assessment. So when we say indicators, we really mean what is an item that we're going to be researching. Maybe we want to know something like heart disease incidence, heart disease prevalence, diabetes incidence, diabetes prevalence. I mean, you come up with this long list of priorities that you want to know either for your priority population or for your community. And then that helps you to narrow down what it is you will be looking into for the assessment. You have to have important conversations. Do things like prison health indicators matter? Do they need to be included? If you're in a geographic area that has a prison health program, then that information will likely need to be included, for example. So these formative conversations really help to get you there. And then throughout the process, it should really be participatory. So you not only have the collaboration at the beginning, but all throughout, you want to be sharing back the information. So if you're collecting information from certain data sites, you can pull together interim types of reports. If you're doing things like focus groups or interviews, you can pull together that information and say, here's what we found from the focus groups, or here's what we found from the interviews. So sharing all along the way so that at the end, it's not a big surprise. And then you also have to keep in mind that the partners will have a level of anticipation about it. They want to make sure that their agenda, their priorities, their mission is reflected in what the needs assessment is discussing. And so there's always that careful balance of how do we reflect everyone's interests and still accurately represent what the needs are. And so when it comes down to, reporting, sometimes you have to massage language a little bit to make sure that you've allowed enough room for organizations to address the gaps while also still being specific about the data. So it's kind of an art and a science, and that's where the collaboration comes into play. And then you want to stay flexible throughout. You want to keep touching bases with everyone just to make sure that there are no needs that have popped up or no new questions, and just staying communicative. So not only is a needs assessment an actual data collection, applied research kind of project, it is still very much a community-based participatory experience for the partners that are involved. And then you can adopt different lenses for the needs assessment that might govern your narrative around some of the indicators, or even how you analyze the indicators. Maybe you look at cancer incidence by race because you have equity concerns relating to late stage diagnoses or higher mortality rates among Black women, for example. I mean, this is real data. You can choose how you frame your needs assessment. So you might have that social justice and equity type of lens. Certain hospital systems, if you're working with a children's hospital, for example, their lens is going to be centered on children. You're going to see a lot more narrative relating to children and families and indicators that are under 18. So you can adopt different overall approaches to the indicators that you select and also how you are reporting it. And then throughout, make sure that you're connecting with national standards, because it helps to lend credibility to what you're saying. You're learning all this great information in this class this semester, what national frameworks are. And so when you're able to bring that to the table as someone in public health, they're relying on you to know assessment methodologies and how do you facilitate these partner discussions. And so there are national standards, if you're talking about equity, for example, that you can leverage. So the class standards or the CLCPA tool that comes out of Georgetown, for example. And then whatever lens it is that you are employing, make sure it's grounded in something. Check out the Healthy People 2030 goals or objectives relating to it. The Robert Wood Johnson Foundation Culture of Health Framework, somehow ground it in a national standard. So it shows that you're being methodical about your assessment approach. And then you get down to the research. So, I see I have 2 C's for census. So you get down to the research. You go per indicator and you get really practical. You put it in an Excel file and you research every single metric that you have decided in collaboration with your partners is important. And so this is, it takes time. This is probably the longest part of the needs assessment. The good news is if you're organized, it's literally an Excel table where you might have all your indicators in one column, then you might have your national stat in another column, then your state level stat, because you're assessing, right? You're going to need to compare what's performing with the average nationally, what's not, and you'll have to talk about these indicators. So that's where this table comes in to be really helpful. So you might have, national, state, and then you might do local, where first you want to make sure that you know what local data is available. Sometimes there is not sufficient local data, or sometimes you have to get the data at the city level versus the county level, or sometimes there's zip code level data available, which is awesome if you want to start doing some maps. Sometimes there's not. And so for every single indicator, you have to figure out what is the most reasonable level of data locally that I can use. And then if you're doing a population centered or equity type of assessment, you'll also need columns specifically for each of the indicators by race, and sometimes race or ethnicity, or if you're doing something related to age, you might need to do age categories, whatever your population might be. At the same time, you also have to think about what level of data is available. Is it going to be reasonable? And so the takeaway is, for the assessment, it's really based on what can amount to a massive chart that is really well organized so that you can start telling a story afterward. And so I wanted to share a couple of data sources. I keep moving the video around. Can you see the video of everyone? And I'm having to move it. Are you seeing me do that? No? Okay.
No.
Okay. I keep having to move it. So, I wanted to share some data sources with you all. As I mentioned, at the primary level, you might want focus groups where you have these collaborative partners, and maybe you want to learn more from their specific communities. If they're at a local nonprofit organization that's centered on housing, maybe you want to talk to their staff. Or if you have prison health clinicians, maybe you want to talk to their staff. So there are flexible options in terms of gathering the data, where you have not only what's in your chart, but you also want to have some meaningful qualitative information. And then I just wanted to include national data sets so that you can refer back to this later that are really helpful. Places like data.gov, the American Community Survey, registries. A lot of the health departments have registries, or there are independent registries per condition. And the county health rankings is also really helpful. And then if you all find that you are looking for data on specific conditions, if you can't find them on any of these sources or CDC, a lot of times there are national associations that will have the information for you. And then I want to add that health departments are a really valuable resource. Locally, if they don't have the information that you are looking for, you can submit data requests to state health departments, and they will give you information. If you're ever in a position of having to do, a study of some kind for a class or anything like that, give yourself time, because it does take time to get the information from them. But they will either have dashboards already on their site, on the health department site, or you can contact their data center. And in Texas, it's the Center for Health Statistics. Each state calls it something different, but you just reach out and they will send you whatever it is that you need. And then, so moving on to what the reporting looks like, you'll have this Excel sheet that you can transform into some kind of visual tool for data comparisons. So that's your opportunity to really analyze and determine how each of the indicators are performing, which indicators are below national and state averages, which indicators are performing better than national and state averages, and depending on your chosen tool, with Excel, you can start color coding numbers so that they stand out to you quickly. And that is going to help you start crafting your story. But at the most basic level, when everything is finished, you will have these metrics per indicator that will help you to start crafting this needs assessment report. And then as part of that, you can leverage GIS mapping if you have the data. There's some pretty cool software out there, Tableau, for example, but you have to have the data really specific at least per county, per city. It has to be really granular. And you almost have to use data sets that are straight from some of the national sites that I mentioned. So then, I'm kind of walking through the process that you can see that it is attainable and it really is organized. It's a lot of information though, so you do have to stay organized the whole time. But once you have that Excel sheet, you know what's performing better than state and national indicators, what's not performing as well. Maybe the state has a disproportionately high obesity rate, for example, or maybe you find that there is a higher level of uninsured individuals that would come out during your needs assessment and would be present and very apparent in the chart that you pulled together. And then you get really, organized, but also passionate and can really convey the importance and the value of the needs assessment when you start the writing. And so that's when you go back to what lens is it that you're doing this from? Are you doing this from an equity lens, relating to race and ethnicity, equity relating to gender, relating to age? What lens is it that you're adopting? And then you take each indicator and you talk about it. Or maybe you group, 3 indicators together and then you talk about them. Because at the end of the day, you're the person that knows the data. And at the same time, you have to explain it to others in a way that they will understand. And so you have to take time to craft that story, that narrative of the true experiences of the people in your local geographic community or your priority population. So this is kind of the fun part. You're getting to make sense of all the data you looked up. You're adding in your focus group or your interview findings. Writing the assessment is where everything all comes together and kind of how you end up with 200 pages sometime. But it's really the opportunity to really make it all make sense. And then the amount of time to complete a quality community health needs assessment, sometimes they're called community health assessments or just needs assessment, is 1 year. And that's with efficient and effective methods. And so that's with convening your advisory partners or whoever you're collaborating with several times during the year. I would say maybe about 4 or 5, 6 times during the year. And that there are no data glitches. I mean, if everything just goes pretty reasonably smoothly, you're looking at about a year to complete a solid needs assessment. So that's really the rundown of the process and why they're so important. From the next, when you get to the next step after doing your CHNA, that's when you can share it with leadership at the hospitals. That helps inform like business intelligence at a hospital, for example. And, maybe they need to hire more clinicians in a certain area or invest more in a certain service line. So clinical services they're offering. At a health department, it's used to help govern the kind of grants that they request from CDC or from NIH or HRSA, other national federal agencies. And so, yes, it's a lot of data gathering. At the same time, when you boil it down into priorities, so once you've pulled everything together and made meaning of it, you will have priorities. It can be used and leveraged to make a difference for the populations and for the local communities. So I really love the process because it allows for data-inspired programming, where you're not just arbitrarily trying to make a difference in public health and don't know if it's necessary. When you can always ground it in some meaningful data, it's really exciting. So I wanted to share, let's see, I wanted to share an example. Give me 1 second of one needs assessment. I have some others. Okay. I don't, you know how it goes. I have like all these screens open and I don't want to share the wrong thing. So I will put in the chat if you are interested. There is a needs assessment for Dallas County that I worked on a while back. And then also I will share information on landscape analysis reports from Susan G. Komen, which is where I work now, where there's a collection of 10 landscape analyses relating to breast cancer and reducing disparities and addressing, you know, mortality in that area. So I'll put both of those in the chat while we are doing some Q&A. So hope that was informative and helpful. I kind of had to speed through it. It's a lot. It's a really comprehensive process. So I'm happy to answer any questions you all have. I know somebody's got a question.
And feel free to use the hand raising feature if you do. I'm trying to scroll, so feel free to use that if you have any questions.
Hi, this is Star. Can you hear me?
Yes.
Okay, I just wanted to know, I know you said that, I guess it depends on the project, how many people that you will have working collaboratively, and 20 just sounds like a lot. So I was just wondering, do you ever run into, I guess, differences of opinions or conflict in trying to get the work done and the needs analysis completed?
Oh yeah, all the time. I mean, there's always a difference of opinion. You know, I think that's why it's really helpful to understand facilitation and understand convening if you're in these community facing types of roles, because there has to be an art of finding what is sometimes called a common agenda. Some people like that term, others don't. But if you're able to, on a continuous basis, show that everyone's input is being considered, you know, and sometimes you do have to make a decision. But if you're able to show that everyone's input is being considered and that you're blending together everyone's priorities, then it usually works out well. And people also understand the nature of these partnerships and they try to keep it as easy as possible too. So it's really about collaboration on everyone's end. But in the event there are hurdles, I find that one-on-one meetings are really helpful. And even preparing people in advance one-on-one and then having your group meeting. I mean, you start kind of developing strategies that work well for you. I also think in collaboratives and in partnerships, you kind of know who you need to offer what so that they feel more comfortable. So yes, there's always differences of opinions, but there's always ways to kind of work around it.
I just feel like when you're working with a group and everyone in there is kind of their own subject matter expert, that sometimes, you know, bringing it all together can be a little difficult.
Yeah, it can be. It can be.
Thank you.
I just put the landscape analysis reports in the chat from Susan G. Komen. They are 10 reports in total, about 1,200 pages of breast cancer and really larger social determinants of health kind of conversation. So if you have time to look at that, that would be a good example for you all. Other thoughts or questions?
This is Dennis. Does every city have a community health needs assessment?
So, you know, and my knowledge on the policy isn't as current. Nonprofit hospitals were required by the IRS to have community health needs assessments. And then if health departments wanted to be accredited, then they were required to have community health needs assessments. And so if you have any hospitals in your area or any health departments in your area that fall under those two, then you would likely have that kind of community health needs assessment available. And then at the same time, I mean, there are nonprofits or other organizations that can do it whenever they feel like it. So it's not necessarily a city or a county kind of checklist. It's more like what kinds of organizations are present.
Thank you.
I had a question as well. So I'm kind of imagining this is kind of a linear process, like you do one step, then you move forward. Is that kind of how you're laying this out as well?
Yeah, I mean, there's always the best laid plans. You know, it's one of those things where you have an approach, you know, these tools work, you know, MAP works for convening, you know, about, you know, creating focus group guides or interview guides. And then there's real life where you still have to be flexible, or, you know, you might get to the end and realize we don't have the data we need for some of these metrics. It's not available at the zip code level or at the city level. I mean, that absolutely comes up. So you still have to be flexible. You have what is ideal, and then you get kind of agile from there.
And then I was curious, so, you know, 1 year to me seems like so long, and maybe that's relatively short, I'm not sure, but, you know, I think a lot can change in a year. Like, what happens if you're mostly through, you've completed your primary sources, or you're trying to get some of your, you know, secondary primary sources, and now COVID hits and you have the needs of the community completely change? Like, what do you do at that situation? Do you have to restart?
Yeah, so this is hopefully an exception, right? Where something like COVID would completely change how a needs assessment is being done, or if a needs assessment is in progress. So I would say in that case, any current needs assessment would need to add relevant data that is available, that is cleaned and accurate. Because what you will find is that even though obviously COVID is happening real time, there are still data delays when you're talking about state and local levels in terms of cleaning it and making it accurate. You know, for other indicators, as far as how often they usually change annually. You know, when you're talking about what is, you know, a certain incidence rate or a certain prevalence rate, the state health departments usually update it each year. In Dallas, you can usually expect it, well, in Texas, I live in Dallas, you can usually expect it maybe in June or July for the prior year. That's how long it takes them to collate everything, clean it, and report on. So the 1 year time frame is not too far off track, so you don't really come into that kind of hurdle. Now, when you start taking longer than a year, then that is when it's more like just hurry up, because now the data is old. So, I mean, you've definitely landed on a very real concern.
And I see Debbie has her hand up, but I'll just add in one thing to that. I think that's true. You know, I'm currently doing some work with Louisiana Public Health Institute on working with the hospitals on the community health needs assessment. And I think, you know, what we have found with COVID is that in some of the interviews and focus groups, we've had to obviously add a COVID, add a piece for COVID, right? So that when we're analyzing it and tagging it, people are bringing up COVID in the discussion. But I think what's found is that, you know, COVID has put more emphasis or more spotlight on things that were already existing, right? And so, like, particularly in Louisiana, you know, there are people have lack of transportation, or, you know, the access to care isn't the best because of the way the hospitals are structured or whatever. Well, those things were already, you know, pre-COVID were already issues. Post-COVID, whatever that even means, are going to be issues. So I think a lot of times you find that emergencies just kind of show where there's already buckling and weakened areas in our system, whether it's a hospital system, community system, whatever. And so it becomes interesting because those things were already there. And like what Dr. Edwards was saying about like the social determinants of health, I mean, a lot of times we're going back to that, and that what you're finding is that they're all linked to that. And that's why, I think it's great that, we've been talking about social determinants of health for so long in public health, but I think it's getting more and more exposure, with COVID outside of the world of public health. So just wanted to share that. Sorry, Debbie, go ahead. I know you had your hand patiently was raising your hand for a very long time. So go ahead.
Thank you. Dr. Edwards, I had a question, sort of what Caitlin was talking about in regards to the length of a quality community needs assessment. So just like, for instance, if you are receiving a federal grant or you have a funder who you're looking to develop a program for, or, using their funds to develop a program, I wonder if a year of a community needs assessment may sort of impede on your progress of, sort of implementing the program. So do you find that oftentimes, while ideally it would be nice to have a year to conduct community needs assessment, do you find that in reality you may have to sort of speed up the progress so you can meet your funders, expectations?
Yeah, so that's a really good question, somewhat transitioning into the operational side of things, where if you're at a large enough organization, you are in a community benefit office or population medicine office, where that is what they do all the time. And then you have separate programmatic offices that are still running, or separate clinical departments that are still running. And so there's no conflict, there's no waiting on the needs assessment to do the services, where, maybe you're requesting funding for a program, you can use last year's community health needs assessment, or the prior, whatever the one 3 years prior would be, or how often you all do them. You just use most recent data available, and maybe you pull a few other metrics just really quickly online. But it doesn't have to be a case where you're just waiting out the current needs assessment. And then in some cases, you might build in at least some time for a needs assessment, where maybe you make it a smaller effort, not as comprehensive, but then you make that part of your timeline. You don't say that you're just doing the needs assessment on the side. That becomes a part of what you're asking for funding to do. So, there's never a conflict. It's definitely about how do you craft it to make it work operationally. And then in terms of programs, they use the data that's current and available.
Thank you.
And I'll just also jump in and say, I think one thing that this is where your partnerships can be really beneficial too, because as you all see, a needs assessment is really resource heavy. And so like for the opportunity I'm working on now with Louisiana Public Health Institute, there was just an organization, a partner organization of ours who had just done some focus groups on maternal and child health. And so what we did is that we just leveraged that data for the community health needs assessment, because you can't do, you could spend forever doing focus groups and interviews and trying to cover each sector. And then you look up and you're like, oh my gosh, like the year is gone. But that's where your partnerships, and I know in this class, we've talked a lot about like building strong partnerships where they can be really beneficial, because maybe someone just recently did focus groups on mental health, in 6 months ago. You can utilize that data, or maternal and child health 3 months ago. You can utilize that data, and so that you can save yourself time and really work efficiently and effectively. I think, one of the slides mentioned that, because this is just the first part, right? Then you may be funded just to do this part, but you may be funded to do the needs assessment and build out a program plan. So it's like, you got to get past that. And just leveraging your partnerships as much as possible can be really helpful and save you some time and resources, especially if you're a lean, a pretty lean team. So. Other questions or comments? I think one thing I would like to you to maybe discuss or mention is, we know best practice of needs assessment is up to a year and working, doing this robust one. But I'm curious if you could talk a little bit about what are some of the real life barriers on why people can't do, a needs assessment, and is it that it's all or nothing, or, can you do kind of a shorter, smaller, more truncated version and still be effective? I think that would be good for people to kind of hear about.
Right. That's a really good question. There's always the balance of how much time you have and how much money you have. And so what I talked through is really, in the ideal world where you can have a multi-methods assessment and you have the amount of time that you need and you have the money that you need, then that's fine. Pricing for one needs assessment for a geographic area, can run upwards of a couple $100,000 plus. And so, even when I saw smaller health departments, for example, who were interested in things like accreditation, but they didn't have all of these resources, their needs assessment did amount to a slide deck. And it was 60 slides. They chose their 60 indicators. And that's what they were able to pull together. It was all from secondary data sources, which tends to be less expensive. You're not facilitating a focus group. You're not doing interviews. You're not scheduling everyone's time. You might have had one meeting with an advisory committee instead of 4, 5, and 6 meetings. So, you can definitely cut back and then offer the appropriate caveats in saying, if we had more funding, or with more funding, we can engage more partners, or, build out the narrative more in terms of analyzing the data. And so it really, you really have to just think about the resources that you do have and then work backward from there, do what you can, what you're able. Maybe it gets boiled down into a dashboard. I mean, you can distill it as much as is necessary, and then over time, hopefully add more depth as time and as funds permit. But you want to have a good picture of what's important for the community, what's important for whatever your priority population group might be if you're doing an equity kind of study. But there are different ways to show that. So do what works best with the resources you have.
Great, thank you. And I know we're coming close on time. I did get, there are a couple questions in the chat for you about, can you explain what some of the costs are for needs assessment and what takes up the budget?
Okay, yeah, so the one I just mentioned, I mean, a couple $100,000 plus, I would say, where a lot of that boils down to staff time. If you're at an organization, you might have 2 or 3 people working on this. And so you have to budget for their staff time. If it's a grant that's funding the needs assessment, then those are line items in your grant budget. You might need software if you're launching surveys, especially, and you have to work with your partners for this. If you're asking partners to maybe connect with their communities or to leverage their email lists, you might be paying for survey software to have access to that. It could be things like meeting space if you need to host your meetings, or if you need to host a public meeting at the end. I mean, there's a range of what the expenses could be. I would say the largest portion, though, is staff time. And then hopefully you somewhat have other items operational. Like if you're doing mapping as an organization, hopefully you have that software available and already covered. So hope that answers your question. And then once again, if you're scaling back, then you're not going to be at that couple $100,000. Maybe you have one person working on it. And so the budget starts to change that way too.
Great, thank you. Any last final question before Dr. Edwards leaves us? Okay.
Hi,
Oh, yeah.
I have one question, and I don't know if it's necessarily a Dr. Edwards question, but as we're talking about the timeline for our needs assessment, the pre-planning, how long does it take from start to finish to complete, to do a program plan?
Well, so the typical, and I guess Dr. Powell jump in, I know you mentioned that the typical approach is that you do the health needs assessment and then you jump into your improvement planning. And so that is when the organizations can somewhat disperse and decide within their organization what programs they want to develop. And then there's a whole different toolkit of program planning. Of course, you all know that then is maybe it's funded through grants, and typically grants are on that 1-year cycle. And so the planning comes somewhat when you're writing the grant, which might be a very short time frame, but then you write into the grant, maybe your first 2 months are planning and convening and making core decisions. So I think it varies on what the program might be,
Okay.
but all that happens after the needs assessment.
Okay. Thank you.
Do you have time for one final question? I see we have one more hand raised.
Yeah.
Okay, thank you.
Hi, Dr. Edward. Can you hear me?
Yes.
Hi. So I just wanted to ask, like, how does it differ, like doing a needs assessment on a global level, like from a national level, like in terms of timeline and the cost? Like, do we still have the same timeline, like if you're doing a needs assessment, like in another country?
So that's a good question. A lot of things would differ. So I can share considerations with you in that if you're looking at doing a global level needs assessment, there still, of course, has to be some scoping around, what countries or what specific geographic areas you're engaging. And then, questions I would want to know are, is this a secondary data analysis? That's less expensive, and you're looking at global data, global metrics that are available. Are you sending people to particular countries to engage in focus groups and interviews or do surveys? And then at the same time, what is the connectivity like in those particular countries? Are you going to be able to reach who it is you're trying to reach? Do you need to leverage mobile technology instead? Do you have to go in country because doing things on the internet is not going to be realistic and people aren't going to respond? I think there are a lot of considerations that that certainly would change how the needs assessment process takes place. So costs would go up, of course, if you have now travel, if you have lodging abroad, if you need translation services, food while you're there. Those are ways where the scope may increase. If there are technological barriers, are you now printing surveys or printing out things? Then that's going to increase your supplies if you're talking about a budget. So there's a lot of ways it can change. The overall method is similar, but all throughout, you're now having to say, is this feasible in the country where I'm trying to go? Or how do we need to modify the approach?
Thank you.
Yeah, we do have some teams that are working, building a program plan internationally and domestically. So that's where some
good
of it,
question.
Yeah, so that's where some of it, gets a little trickier when you're international, just for resources perspective, at least. So great. Are there any final questions? I know you have to go, so I do want to be mindful of your time and just thank you so much for sharing with us. And these resources are great. I have them bookmarked because they're really nice and lay things out very clearly. So appreciate you sharing, your experience and your leadership in this space, and we really, really appreciate it. So.
Thank you, Dr. Powell. Thank you all for asking some good questions. I'm available